What would you say if I told you that a simple test, one that takes just minutes in a clinic, could quietly push you toward a lifetime of side effects, or even a surgery you never needed? Imagine walking into your doctor's office for a routine checkup, feeling fine, maybe a little slower than you used to be, but generally, well. Your doctor suggests a scan standard for your age. They say it seems harmless. You nod, you trust them. Weeks later, you're taking a medication with side effects no one warned you about. Or worse, lying in a hospital bed, recovering from a complication you never saw coming. This isn't fiction. It's happening every day to millions of adults over 70. New research reveals that up to 37% of routine medical tests in seniors lead to unnecessary procedures, medications, or life-altering complications. Even more disturbing, 99% of older adults have no idea they're being overtested, overdiagnosed, and overtreated. You won't hear this on TV commercials. You won't find it in a glossy pamphlet at your clinic. But the truth is hiding in plain sight in the scientific journals and patient stories, and now in this video. Let's begin with a checkup that almost sounds too gentle to be dangerous: the bone density scan. Also known as a DEXA scan, this test is often promoted to seniors, especially women, as a smart, no-risk way to find out if their bones are brittle or at risk for fracture. It's quick, it's painless, and it sounds proactive. But for people over 70, it may be far more harmful than helpful. Here's why. After age 70, bone loss is completely normal. Like gray hair or wrinkles, it's part of aging. But the DEXA scan often flags this natural decline as a medical issue, even when there's no real danger. You get a diagnosis like osteopenia, a term that sounds scary but usually just means mild thinning of bones, something almost every senior has. That diagnosis often leads to prescriptions for bisphosphonates, a class of drugs meant to strengthen bones. The names are familiar: Fosamax, Boniva, Actonal. But their side effects, not so widely discussed. These medications can cause serious problems: jaw necrosis, where parts of the jawbone actually begin to die; esophageal irritation, leading to chronic pain, difficulty swallowing, and ulcers; even spontaneous bone fractures. In places where bones don't usually break, like the femur, have been linked to long-term bisphosphonate use. And here's the kicker. Multiple studies show that for people over 70, especially those who haven't had any fractures, these medications provide very little actual benefit. A major study published in the Journal of the American Geriatrics Society followed over 1,200 women over age 70. After 5 years on bisphosphonates, their fracture risk decreased by just 0.3%. That's barely a fraction of a percentage, and hardly worth the risk of side effects that can dramatically reduce quality of life. Take Rose, for example, a 76-year-old retired piano teacher. Active, healthy, no history of falls, and walked every day. Her doctor ordered a DEXA scan as part of her annual physical. The result? Osteopenia, no osteoporosis. But the doctor still prescribed alendronate, a bisphosphonate. Within months, Rose developed severe acid reflux and jaw pain. Playing piano became uncomfortable, then impossible. When she came in for a second opinion, we stopped the medication and started a non-pharmaceutical approach: vitamin D supplements, a calcium-rich diet with sardines and leafy greens, and gentle resistance training with exercise bands. A year later, she was back to performing stronger, steadier, and pain-free, and science supports this approach. A 2022 study in Osteoporosis International found that lifestyle-based interventions, strength training, balance exercises, vitamin D, and proper nutrition reduced fracture risk in seniors by over 20%. That's 70 times more effective than the drug in Rose's case. The problem isn't just the scan itself, it's what comes after. A single number on a screen can spark a cascade of fear, prescriptions, and complications. And for seniors who've never had a fracture, don't have a high fall risk, and are generally active, the best path to stronger bones might not be a scan or a pill. It might be as simple as lifting light weights, getting more sunlight, and eating a few more leafy greens. But if you think that sounds unsettling, wait until you hear about the next test. It's one that promises to explain memory lapses, but can lead to brain surgery, spinal taps, and devastating anxiety, all for changes in the brain that might be perfectly normal. Most people believe that if you're starting to forget things more often, like where you put your glasses or the name of a neighbor, you should see your doctor right away. That part is true, but what happens next is where things often go wrong. Far too often, a well-meaning doctor responds to these concerns with an expensive, intimidating test, a brain MRI. At first glance, this might seem like a smart move. After all, isn't early detection the key to fighting dementia? But in reality, getting an MRI for mild memory complaints after the age of 70 can lead to more harm than good. The brain changes as we age. It's a fact. Small shrinkage, subtle white matter spots, and minor blood vessel changes are all part of normal aging. But when these completely typical findings show up on an MRI, they often get flagged as abnormal. And that one word, abnormal, can set off a chain reaction. More tests, referrals to neurologists, invasive procedures, and deep, lingering fear that you're losing your mind. Let's be clear. MRs do not diagnose dementia. They only show structure, not function. So when someone like George, a 74-year-old retired engineer, comes in feeling anxious about forgetfulness, an MRI is rarely the right first step. George was sharp, independent, and still volunteered at a local school. But he had started misplacing his keys more than usual and forgot a few names at church. Understandably, he worried. His doctor scheduled a brain MRI to rule out anything serious. The scan came back showing white matter hyperintensities, a common finding in older adults, not a sign of disease on its own. But George didn't know that. The word hyperintensity stuck in his mind like a warning bell. He stopped driving. He withdrew from social events. His anxiety spiked. He became more forgetful, not from dementia, but from stress. When he came to us, we did a simple paper-based cognitive screening test, the MOCA, Montreal Cognitive Assessment, to measure his memory, attention, and problem-solving. He scored well within the normal range. We showed him the results, reassured him that his MRI changes were age-appropriate, and recommended a few practical lifestyle shifts: better hydration, consistent sleep, and daily brain games like crosswords and storytelling with his grandchildren. 3 months later, George was back to himself, no medication, no additional scans, no procedures. Here's what most people don't realize. 86% of brain MR is in seniors show some form of abnormality, but only 3% of those findings are linked to a condition that requires treatment. That means 97% of seniors go through the emotional roller coaster of a scary result for no actionable reason. And in nearly 12% of cases, those scans lead to invasive procedures like spinal taps or brain biopsies that carry real risks, infection, nerve damage, and a very real possibility of cognitive decline due to the stress of surgery. So what's a better first step when memory issues show up? Instead of a scan, a cognitive screening done in your doctor's office is fast, low cost, and more useful in identifying whether the problem is serious or simply a side effect of stress, dehydration, sleep issues, or even medication. Many memory complaints in seniors turn out to be reversible when addressed this way, without ever stepping into an MRI machine. And even if a deeper look is truly needed, doctors can often start with less invasive tools, blood tests to rule out vitamin deficiencies or thyroid issues, medication reviews to identify side effects, or hearing tests, since hearing loss is now strongly linked to memory trouble. These approaches target the root causes of memory decline more effectively than simply peeking at the brain and hoping to find a label dot. So unless you're experiencing red flag symptoms like sudden seizures, drastic personality changes, or rapid functional decline in MRI is not likely to provide clarity. What it often provides instead is confusion, panic, and a long road of unnecessary follow-up. Unfortunately, that's not the only test sending seniors down dangerous paths. There's one more that's nearly universal, often ordered without much thought and capable of triggering hospital stays, kidney problems, and surgeries that were never needed in the first place. That next test might sound familiar because it's one of the most commonly ordered procedures for older adults, the cardiac stress test. If you've ever mentioned feeling tired, lightheaded, or a little short of breath to your doctor, chances are they've suggested it. The idea seems straightforward. Put your heart under stress, either by walking on a treadmill or using a drug that mimics exercise while hooked up to monitors. If something's wrong, it should show up, right? Not always, and especially not for people over 70 who don't have clear signs of heart disease. The cardiac stress test was designed to detect serious blockages in the arteries, the kind that lead to heart attacks. But the problem is, in older adults, the test can be wildly inaccurate. In fact, the false positive rate, meaning the test says a problem when there isn't, can be as high as 40% in people over 70. That's almost half. What happens next is a medical domino effect. A mildly abnormal test often leads to a catheterization, a procedure that threads a tube through your arteries to take a closer look. That can then lead to the placement of a stent, a small metal mesh that props the artery open. Sounds proactive, but here's the reality. For seniors without classic heart symptoms, these interventions often offer no improvement in lifespan or daily functioning. What they do offer is a much higher risk of complications. Take Raymond, a 75-year-old retired postman who stayed active by walking his neighborhood hills. At a routine visit, he casually mentioned that he felt more tired than usual when climbing a steep slope. His doctor ordered a stress test just to be safe. The results were ambiguous. That led to a catheterization. During the procedure, they found a mild narrowing, nothing life-threatening. But a stent was placed anyway. That same night, Raymond developed a reaction to the contrast dye used in the procedure. His kidneys began to shut down. He was hospitalized for 6 days, placed on 4 fluids, and had to rest at home for weeks. The fatigue? It turned out to be due to mild dehydration and skipped meals, something easily fixed without invasive testing. And Raymond is not alone. A 2017 study in JAMA Cardiology revealed that more than half of all stents placed after stress test referrals were done in patients who didn't have significant symptoms or benefit. These patients experienced no boost in survival or quality of life, but faced increased risks of bleeding, kidney damage, and unnecessary hospital stays. Now, this doesn't mean heart testing is never useful, but for older adults who aren't experiencing clear cardiac symptoms like chest pain during activity, shortness of breath while walking, or dizziness triggered by mild exertion, stress test may open the door to risks that far outweigh the rewards. There are safer alternatives. A resting EKG, for example, checks your heart's electrical rhythm while you're sitting still. It's quick, painless, and often sufficient as a first step. Another option is the coronary calcium scan, a low-radiation CT scan that checks for hardened plaque in the arteries. It's non-invasive, fast, and provides a clearer risk picture without unnecessary stress or procedures. But the most powerful tool of all might be something much simpler: a conversation. Talking openly with your doctor about your symptoms, activity level, and goals can help you both decide whether testing is even necessary. Because tests are not neutral. They come with emotional consequences, potential side effects, and sometimes unneeded interventions that take a toll on your body and your spirit. And as you'll see in the next section, that toll can be devastating. There's a test that most seniors are urged to get regularly. It's invasive, exhausting, and comes with 10 times more risk than benefit after a certain age. And yet, many people over 70 are still being told it's essential. That test is the colonoscopy, a procedure so ingrained in our healthcare system that questioning it almost feels taboo. For decades, it's been marketed as a life-saving screening tool for colon cancer. And for many people, particularly those under 70, it truly is. But once you cross into your mid-70s, the benefits begin to drop sharply, while the risks climb just as fast. You've probably heard it's routine. Maybe your doctor reminded you that it's been 10 years since your last one. Maybe you were told, better safe than sorry. But what most seniors don't hear is this: by the time you're 75, colonoscopies can cause more harm than good, especially when you have no symptoms and no family history of colon cancer. The preparation alone is brutal. Strong laxatives flush your system, causing dehydration, dizziness, and in some cases, kidney stress. For older adults whose bodies process fluids and medications more slowly, this can lead to serious complications even before the scope is inserted. Then comes the sedation, which adds another layer of risk, particularly to brain function. Studies have shown that seniors sedated for colonoscopies have higher rates of post-procedure confusion, delirium, and longer-term cognitive changes. And that's all assuming the test goes well. But the truth is, colonoscopy is an invasive procedure. It carries a small but real risk of bleeding, intestinal tears, and even cardiac rhythm disturbances caused by the sedation. In 2019, a large study published in JAMA Internal Medicine analyzed over 1.3 million Medicare patients aged 70 and older. The findings were startling. For every 1,000 colonoscopies performed in people over 75, only 2 lives were saved, but more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio, and one that should give us pause. Let's look at Dana, a vibrant 73-year-old grandmother who ran a bakery with her daughter. She had no digestive symptoms, no history of cancer, and had already had 2 clean colonoscopies earlier in life. But during a checkup with a new physician, she was urged to get another one, just in case. Trusting the advice, Dana agreed. The procedure seemed routine at first. A small polyp was removed, and she was sent home. But that night, Dana collapsed in her bathroom with intense abdominal pain. She had suffered a bowel perforation, a tear, in the wall of the intestine. She was rushed to the hospital, spent 9 days in recovery, lost significant weight, and hasn't fully regained her energy since. The worst part? Her previous screenings already showed she was at very low risk. That colonoscopy wasn't just unnecessary, it changed the course of her life. This isn't to say colonoscopies are useless. For those under 75 with risk factors like a personal history of polyps, symptoms such as bleeding, or a strong family history of colorectal cancer, they still have value. But for the average healthy senior with no symptoms, there are safer, less invasive alternatives. One of the most effective is the FIT test, a stool-based screening that can be done at home. It checks for hidden blood in the stool, an early warning sign of colorectal issues. No prep, no sedation. And yet, it detects most of the same early warnings that a colonoscopy would, without the same level of risk. The U.S. Preventive Services Task Force, one of the most respected health guideline bodies in the country, currently recommends stopping routine colonoscopy screening at age 75 for most individuals. But many clinics and doctors haven't caught up. That means it's up to you as the patient to ask the right questions. Do I really need this? What are the risks? What happens if they find something? Because once you're in the colonoscopy cycle, it can be hard to get out. Small polyps, even if benign, often trigger a repeat schedule. Come back in 3 years, then again in 5. It becomes a loop of testing, worry, and follow-up that may never have been necessary in the first place. And if you think colonoscopy is the most overused test for seniors, think again. There's one final checkup that's become popular in elite clinics and executive health packages. It promises peace of mind, early detection, and a full-body view of your health. But what it actually delivers may be far more dangerous. It's called the full-body CT scan, and on the surface, it sounds like the ultimate health safety net. Imagine being able to scan every organ, every inch of your body, and know exactly what's going on. No missed cancers, no hidden threats, just complete clarity. That's the promise. But for older adults, particularly those over 70, this test is not only unnecessary, it can actually cause the very problems it claims to prevent. Let's start with the basics. A full-body CT scan uses ionizing radiation, a form of energy that penetrates tissue, to create detailed images. The problem? It's not harmless. Each full-body scan delivers the equivalent radiation of about 500 chest X-rays. That's a staggering dose, especially when you consider that most seniors already have a lifetime of medical imaging behind them. According to a 2023 study published in JAMA Internal Medicine, the increased use of CT scans in asymptomatic people, those with no symptoms at all, may now account for up to 5% of all cancers in the U.S. That's the same cancer risk attributed to daily alcohol consumption. That means 1 out of every 20 cancers may be triggered not by lifestyle, not by genetics, but by the test meant to detect them. The risks don't stop there. These scans often reveal incidental findings, tiny nodules, harmless cysts, or age-related calcifications that are perfectly normal. But once they're seen, doctors can't ignore them. You're sent for more scans, follow-ups, biopsies, or worse, surgery. Procedures that carry real risks, especially in older adults with slower healing times and greater sensitivity to medications. Consider Marcus, an 80-year-old martial arts instructor for seniors, fit, strong, and symptom-free. He signed up for an executive health screening at a high-end private clinic. The package included a full-body CT scan. That scan found a tiny 3 millimeters nodule in his lung far too small to be causing any issues. But protocol dictated a PET scan, then a needle biopsy. The biopsy caused a lung collapse, a known risk, and Marcus ended up hospitalized. He lost weeks of strength and function recovering. And the final pathology? Benign. That tiny spot would never have hurt him, but the test to keep him safe nearly did. And he's not alone. The American College of Radiology has clearly stated that full-body CT scans should never be used as general screening tools, especially for asymptomatic adults. There's no proven benefit, no evidence that they save lives, and yet they remain popular, marketed as cutting-edge prevention to older adults eager to stay in control of their health. But here's the truth. Health isn't just about finding problems. It's about knowing which ones matter and which ones don't. It's about choosing the right battles and sometimes choosing not to fight at all. For seniors, especially those in generally good health, these tests can quickly become a slippery slope, each scan revealing something else, each result raising more questions than answers, each step pulling you further from the vibrant life you want to live. So what's the smarter approach? It's surprisingly simple. Listen to your body. Stay in close contact with a trusted primary care provider who understands your history and goals. Get regular evidence-based checkups that are appropriate for your age and risk level. Ask your doctor before every test, if this finds something, what happens next? Will it change how we treat it? Will it improve my quality of life? Or am I just looking for something to worry about? Because true prevention doesn't always mean doing more. Sometimes it means doing less and doing it wisely. Your energy, your independence, and your peace of mind are precious. Don't let fear-based screening take that from you. You deserve to age with clarity, not confusion, with confidence, not caution. The most powerful medicine isn't found in a machine or a pill. It's found in movement, in sleep, in good food, in meaningful connection, and in the wisdom to ask the right questions. Now, we want to hear from you. Have you or someone you know ever gone through a medical test or treatment that turned out to be unnecessary or even harmful? What did you learn from the experience? Share your story in the comments. We're reading every one, and your insight could help someone else make a better choice. And if this video opened your eyes or gave you a new perspective, don't forget to like, subscribe, and share it with someone you love. Because better decisions start with better information, and better health starts right at home.